All right, we're less than a minute to go. We'll go ahead and get it kicked off here.
Okay.
Well, hello. I am really excited today. Life's Co-Pilot, who's, by the way, Life's Co-Pilot is brought to you by Caring Transitions. We put that in. It's just a free service to our consumers and our friends and to seniors and seniors' families and caregivers, just so you can get straight line information without a lot of BS. So you can always go to lifescopilot.com, or you can find us on Facebook. But today we have Luis Hernandez with Centerwell Primary Care, and he's going to be talking about a new, well, you're not the first. I mean, I think Oak Street was first. You guys came in second. I love their model. I love your model, and I'm thrilled to have competition, because I think that makes everybody better. Okay, early on with Life's Co-Pilot, I had competing people against Caring Transitions on there too, because to me, I think that we all win when we have more people, trying to tweak and make it better all the time. So, Luis, tell us about who you are first, and then let's find out about Centerwell. You guys have only been in town a short time.
So yeah, my name is Luis Hernandez, and I'm a community engagement professional for Centerwell. I'm located on the Pendleton Pike location in Lawrence. I'm 24 years old, and like I was telling Jim, my background is finances. I did banking for 5 years, and life changed me and moved me to healthcare. I was telling him that my grandmother passed away at age 63, never smoked, very healthy woman, hard worker, very nice lady, and she passed away under the wrong care in 10 days, 7 days, something like that. And that changed me to the healthcare system. Um,
Well,
this job,
before you go any further, you just told me the story. Tell them the story, because this is something that people need to hear about.
okay. So my grandmother, like I said, very healthy woman. She got into the emergency room in one of the big hospitals, and she started getting worse each day. Around the fifth or sixth day, they would tell us that she was ready to go home, but she couldn't walk, she couldn't stand, she was very sleepy. So my family, we fought with the hospital and doctors, telling them that she couldn't be released as her situation was worse than when she came in. Um, they ended up letting her stay overnight. The next day around 5 a.m., they gave us a call and told us that she was in ICU, that she was dehydrated and septic. Um, 2 or 3 days later, she was living off machines all around her body. And the next day, she passed away at 8 p.m. So that was my first time that I experienced somebody very closely passing away. And the whole situation was very hard because you don't want to see any family members or any person going through all what she went through or what we went through. So that changed my whole life and perspective and everything. But 3 weeks after that, I met a beautiful woman. Her name is Rachel. She was introduced to me, and she told me about Centerwell. And I just knew the name of the company. That's it. I didn't know what they were doing. I didn't know what it was about. She just told me, "Give me a call next day." The next day, I called her. She told me about everything that this position had to do, which I will talk later more about that. But she was like, "Hey, if you want to do this, just apply for it." Apply. 2 weeks later, I got the job. I think maybe even a week. But I love doing what I do, and it makes me happy when I can help seniors, which this is what we're focused on. Like you said, Centerwell is very similar to Oak Street. We are a value-based care doctor office, which we focus on seniors, but we also focus on anybody that is on Medicare. So in order to come to us, you have to be on Medicare, which is can be people that are over 65 and they retire, or people that have been on disability for over 3 years and they qualify for Medicare. Um, one of my position actually as a community engagement is to be outreach, to be out in the community and showing people what Centerville can do, what the benefits are, and how people improve their health with us. As at the same time, I create events for them so that we can keep them healthy, we can keep them socialized and active, just interacting with each other. So we just keep our seniors in our communities just going and going and going and just knowing and learning more. As one of my good friends says, knowledge is power. And if they know things, and even if it's not for them, they can help somebody else just sharing the information that I provide to them.
So you say you do Medicare? I know that. Do you also do Medicaid or
So basically, for us, they have to have first Medicare, and
right?
if they have Medicare and Medicaid, is fine. But Medicare supplemental, Medicare Advantage plan,
Right.
but they have to have the principal Medicare in order for us to see them.
Okay. Right. That's
Um,
I mean, a lot of most Medicare waivers would have the Medicare first. Yeah.
Yes, exactly. So, like I said, if you're over 65 and you retire, or if you has been on disability, you qualified with for Medicare, and that it helps you just to come here. As we're just focused on the Medicare popularity.
Well, you guys, I know, are very different than what most people are accustomed to in the medical profession. You know, I understand that today the average doctor's appointment is 6 minutes. Okay, so trying to get all your questions answered and have somebody that's not spending that 5 of that 6 minutes typing on the computer is the next trick. So
So yeah, I always tell everybody this that it happened. Well, I just been saying this for a little bit over a month. My mom has cancer, breast cancer level 1, and she went to her primary doctor because she had a lot of questions, and she's been having her legs been swelling a lot, and we don't understand why, and it's been going on for a year. She went there. I couldn't go because I always go with her, and like maybe she waited for her like 25 minutes in the exam room, and when she came in, she didn't even spend 15 minutes with her. And at the end of the um um oh god, at the end of the appointment, she asked the doctor, "Hey doctor, we haven't talked about my legs. Like this has been going on." And she goes, "I don't have time for you right now. Like, would you have to schedule another appointment
wow,
to talk about this?"
six
I
months from now or whatever. Yeah.
Exactly. I told my mom, first of all, she's very lucky that I wasn't there because I only have one mom and I will do anything for her. But also, how a doctor or provider that you are giving all your trust on your health is going to tell you that I don't have time for you, or I don't have time for that right now. You have to schedule another appointment. And that's one of the things that I love about this job because as a bio-based care, we provide over 15% more time or one-to-one time with your provider. So the first appointment when we schedule somebody for first time here, and I basically tell them that it's basically for you to get to know the provider and the provider get to know you. So we always tell them, hey, bring a list, a book, and a list of all your concerns. If you on Monday get up and your right ear hurts, and then on Tuesday you get up and your left ear hurts, we want to know all about it because the doctors will have everything in our system. And in the following appointments, they will start helping you to go through all those concerns and the issues that you have. So like I said, the first appointment is 60 minutes. And the following appointments, it depends of the needs of the patient, but normally they're from 25 to 30 minutes, 35. Some patients have telling me, hey, she's been with me 45 minutes each time that I go there because of all the concerns that I have. So our doctors spend longer with them because they actually care. On top of that, another comparison is our doctors see from 8 to 10 patients a day while regular doctors can see from 20 to 30. Our providers also have blocked times throughout the day for emergencies. So we have same and next day appointments, which means that if the patient is sick, we keep the promise on seeing you the same day. So the patient give us a call and we will schedule them same or next day, depends of their schedule. Or if they cannot come to their own provider, we will send them to other provider in our clinics. So those are different than just a regular provider, as they don't spend time with you. We do, or they might not see you in 4, 6 weeks. We can see you the same or next day. Or even if you're a new patient and you need to see a provider, well, today's Thursday, but if it was like a Monday, I can promise you that you will have an appointment by Wednesday or Thursday or Friday. Like we have those appointments open for new patients and for people that actually are on emergencies.
That's excellent. Now you were telling me you had a presentation you wanted to show as well. Do you want to get into
Yeah,
that? Go
yeah, of
down
course.
at the bottom. There's a little green button. So.
Yeah, yeah. Let me see. Can you see that?
Hmm.
So yeah. So I don't have like a long presentation, but basically this will show us a lot about Centerwell and what we can do. One of the things that I want to go back is when you mentioned in the beginning Oak Street. So yeah, we're like Oak Street. We're value-based care. But one of the
Explain
things
that.
that, yeah, so value-based care means it actually the doctors spend more time with you and they actually care about you. And it's not like a scheduling doctor. So scheduling fee is just the provider that see you 15 minutes and that's it. Value-based care actually takes care of you in a different way because they actually can spend more time with you and they can, help you and improve your health. Because the goal for us is that you see less specialists, everything stay in the house, keep you away from the ER, from the urgent care, and improve your health without medications and to help you to reach, to be longer with your family. And we are owned by Humana, but we accept all the Medicare insurance plans. And one of the things that Oak Street, Humana used to be a bigger investor, but Humana just wanted to do their own thing, and they have Conviva on the south and Centerwell on the north. And we have
What was on
over
the
three.
south?
Yeah, Conviva,
Conviva
CON.
is the same. It's the same entity, but just a different name.
Yes, yes.
Okay.
So in the south, because there's a lot of Spanish-speaking popularity,
Hmm.
so they are very familiar with that word. So we're just gonna keep it like that. And then the north side is more like a Centerwell. Um, But yeah, we are over 15 states and we have over 300 locations. And we keep growing. Like we're growing very fast. And like my patients, they love Centerwell and they have seen an improvement. But let's just start talk about like what Centerwell is and what are the things that we provide. Um, so Centerwell, as you can see, we are structure with different departments. And we have the registered nurse and care coaches. So we have nurse practitioners here. We have doctors, behavioral health specialists. So if a patient is with a provider and they express some kind of depression, anxiety, loneliness, or anything like that, we also can take care of that in the house. So the doctor can actually help you and they can manage those symptoms or feelings and try to help you to go through that and be manageable. We have also social workers. So those social workers, when you express some kind of food insecurity or financial trouble or any concerns that you have outside of your health, we have that team that can help you to find resources. As a community engagement team, which it will be me, social workers, doctors, like the whole team work very closely with me because I'm also a great resource for food pantries or people that work in the financial side. Or some patients have questions about their Medicare plans. I can find an agent that I know that I can trust and I can send it to them because I know that they will be looking at or they will be actually caring about them and not just about money, just signing up a policy and that's it. Because these agents are independent and they actually care about the client. And we have pharmacists too. So in some markets, Centerwell have a pharmacy inside of the clinic, so people can also take their medication from there. But in our case, we work very closely with pharmacists to make sure that the doctors, when they're prescribing a medication, that medication is right for the patient and they're doing the right doses and everything. So it's not just like a doctor just coming in and just, like I said, the regular doctor, oh, you have just pain in your back, okay, just take ibuprofen and that's it. So no, these doctors actually take their time closely with pharmacies and other departments to make sure that we're giving you the best medication on 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 what you're going through. Um, Sorry. Like we were saying, the experience of new kind of primary care that puts you first. We talk about the 50% more one-on-one time with your doctor. We have the same or next day appointments when you're sick and you have urgent care, or you don't have to go to the urgent care or ER. Personalized proactive healthcare. So one of the things of value-based care is that we are proactively taking care of you instead of the reactive way. So doctors or regular doctors, when you go to the doctor, it's because you're sick. I'm coughing, I have fever, or I have all this pain. So those are reactive doctors. In our case, we're proactive. So we are on top of your health and preventing what could happen in the future. So those are like a big difference between our regular doctor and our value-based care doctors.
So how do you do that? How do you become proactive? Do you have like more appointments that are scheduled during, without the "Hey, I'm sick" call?
So when a patient comes in, if they're sick or if they're not, they always, our providers run tests to make sure that all the levels are good, to make sure that they're healthy or they're not. They also, like we said, always bring the concern list, all what you're going through, what you're feeling, pains, problems, anything. We want to make sure that we know everything about you. Plus, we also ask for medical records from other providers. So when we see all that, our doctors proactively, they actually care of, like, take care of them from, okay, so we're seeing that, I don't know, like your sugar levels are high, so we're just going to start working on that, and they just help them before it gets aggravated or it gets actually sick. So because our goal at the end of the day is to keep them healthy and to keep them out like of pills or like all the medication, because we're trying to get them away from getting sick. So our providers, they're not like, I'm gonna see you every month to take care of you. Because when they run all the tests, if they see that the person is very healthy, we're like, okay, let's just follow up in 6 months or follow up in 3 months. It will be depends of each case what their what the patient is going through, and the provider will review that and talk to the patient about that.
So basically,
Um,
depending upon how healthy someone is, it could be 6 months before they come back in, or if they really are concerned, it could be like a monthly thing until they
yeah,
can. Okay,
yeah, yeah.
okay, that's
So
not
one
your
of
tip. That's not typical within your doctor's system and normal.
No, no, no. The doctor, you come in and they see you, give you a medication, and that's it. Our providers, when I remember my first ever patient that came in, that I gave the tour and everything, he had a follow-up appointment the next week, and I was like, "Why are you doing that?" And he's like, "Well, because we run some levels and they're pretty high. So we're gonna see him next week, and then we're gonna see him once a month until those levels actually go down, and then we can space out those appointments, because our goal is not for them to be here once a month. Our goal for them is just to be seen every 6 months because they're healthy
Hmm.
and because they know that we're here and we're taking care of them proactively instead of just a reactive when, okay, you're sick, come in. No, we want to keep you healthy. And some other patients are very, very healthy, which we can see them sometimes when just they just have an emergency. or they just when they get sick. But for us, we want to check them all the time to make sure that they're doing good and they're healthy. That's what value-based care is. Um, we also have a dedicated care team to coordinate specialists in medicine. So Centerwell is not like a network, a hospital like is with IU or with a community or Riverview. We actually can work with all of them. So one of the biggest concerns that patients have when they come in here for first time is like, well, I have a cardiologist and I don't want to give up the cardiologist. Like, what can I do? Well, you don't have to give up your cardiologist or your specialist doctors. If you've been working with a provider for 15 years and in that side, like a cardiologist, and you're very healthy because the provider helps you, we actually want to know that information. We want to know the name and the phone number and where that provider is located. So we keep in touch with them to let them know what we're doing here and for them to let us know what we're doing there. So we're both working together on their patient's health. So they don't have to give up the specialist, which I know that's a biggest concern from a person perspective when they're looking for a new doctor. Um, like the 24/7 access to care team. So, like I said, we have the same the next day appointment, but if we're talking about a Friday night or a Saturday night and they get sick, well, they can give us a call to the front desk, and the front desk will be redirect to a call center, and that call center will send the call to one of our providers. So, in Indy, we have 5 locations. Okay, and each location has 2 providers so far. Well, one of those providers are on call a whole week. So when they give us a call and it's after hours, one of our doctors, local doctors here, will give a call back to the patient and we talk to them about like, hey, what's going on? What are your feelings? What are your symptoms? Like, what are you doing? And then they can check if the person needs to actually go to the ER or urgent care or just wait until Monday morning and we will see them first thing in the morning to take care of them. So our job doesn't just end at 5 o'clock. We actually have providers on call that can help our patients throughout the night or on a weekend, which is different than a regular doctor. Um, we have the transportation coordination. So one of the biggest complaints that we get is that people, hey, I don't have a car or I don't have the money to go there. Like, what can I do? Like, well, we offer transportation. And we have 2 things, 2 ways to get transportation to patients, and it's at not cost. So the patient has not cost or will be billed from us because of the transportation. So if a patient is very well maintained and like they can walk perfectly fine, they don't have any like interruption or any like I don't want to say a walker, but let's talk about a wheelchair. We have private Uber will pick them up in their home, drop them here, and it will do the same on their way back. So they don't have to share a ride with somebody else. This private Uber will pick them up and drop them off. Okay. And if they're in a wheelchair, we have something called D6, which is a local company, and they will go to their place. They will go into their apartment, get them ready, make sure that they have everything, take them to the van, drop them off here, and do the same on their way back. So that is different. That is not like other transportation where they just wait outside for them. This is actually very good for people that are on wheelchairs because they have a better approach and they feel better when somebody's going into their apartment, knocking at the door, and making sure that they're all good and taking them outside, dropping them inside of the clinic and doing the same way on their way back to home. So
It's very cool.
yeah, that's completely different. It's a life changer for some people. It's like, hey, it has been great. Like, I'm better. I don't have to worry about transportation. I don't have to worry about Like if I forget something, I don't have to worry about like me pushing my wheelchair, like somebody's helping me to do that. So that's different. And then we have the community events, which I'm in charge of it. And throughout the month, we have an activity center here, which that activity center, we do bingo, price is right, exercise classes, which these exercise classes are not like people think that they're gonna be fitness and all that. No, these exercise classes are designed for seniors, like stretches, like heart exercise to make sure that you're keeping your heart rates right. I mean, yoga, things like that that can help them. We also have doctor talks. So on October 25th, one of our providers, she's having an event talking about eating healthy, weighting loss, and we will provide lunch and we will provide recipes on how they can eat healthy. So those are events that we can do here in the house, and people can join them without being a patient and also at not cost. So it's a service that we provide to them. And the same way we're trying to go to senior places, senior facilities, and other communities to take these events and do them out there. Um, if when we talk about our clinics, so and before I jump to that, I want to talk about a little bit of the providers. So as I mentioned before, our providers see from 8 to 10 patients a day, which is great, right? Um, we have so far in each clinic a medical doctor and we have a nurse practitioner. They both work together on your health. So when a person or a patient comes in and they decide to see the nurse practitioner and the medical doctor are taking care of you together, but you will always see the nurse practitioner and on their way with the medical doctor. You've seen the medical doctor, but both of them are taking care of you. That medical doctor is capped in 500 patients, when normally a regular doctor can be capped from 2 to 3,000 patients, and our nurse practitioner is 250 patients. So that's a huge difference between what we can do and the healthcare we can provide with other healthcare providers. So that's a big difference.
It is huge.
And yeah, it is. And when they
I
both,
mean, we've been kind of bashing the doctors on not having any time with people. It's not the doctors that are doing it; it's the hospitals and the places they're working for that give them. They got this many minutes that they have to do things.
oh yeah, so when we have an opening here, we get the best of the best because doctors, they actually want to spend time with you, but they can't. That's the difference. Like doctors want to spend time with you, but they cannot do that. In our case, when we're trying to keep all our promise, or when we're trying now, when we keep your promise, when our doctor and nurse practitioner combine, they get to 80% of their capacity, we're going to hire a new provider. So we will always do that to keep the promise on same and next day appointments, longer appointments, making sure that we have a space for emergencies, all of those things because we don't want to change our system because we're growing. We're not going to do that. We're going to keep all the promises all the time. So that's what is also different from other providers. Um, our clinics, they normally have from 8 to 12 exam rooms. So we have plenty of space as we grow. We can cover all those exam rooms. So people don't have to worry about saying, well, you know what, as you guys grow, I'm not gonna be able to spend the same time with my doctor. Well, no, we're actually gonna keep the promise. Um, but as soon as you come into our lobby, which is this side right here on the left, our lobbies are very spacious. They have the non-skid floors. So when people are worried about falling or if they have problems with balance, they don't have to worry about that because our clinics are designed for seniors. And when they were designed and they thought about everything for the non-skid floors, from the weighted chairs, so when you get up, they don't move around and they're worried about falling, from the big spacious and like wide open and light places, so they can see everything from the wide doors and hallways. So our hallways are pretty big, so anybody can fit through it. Wheelchairs, walkers, caregivers. So that's what is different on us. Um, I don't know if somebody has any questions so far, or I'm speaking too
Not right
fast.
now. I'll let you know if we see something.
Okay. If we go to here, on the left side is a little example of our exam room. So the first thing that you can see is that we don't have that table where people have to like jump on the wall. We have that chair, which we all call it the Cadillac of the chairs in the medical field. That chair, um, when a patient sits there, that chair can rise, can lay, can go back to the original position, and it's also heated. So the patient don't have to do anything. And it also has arms, so they feel safe that they're not gonna fall while the chair is moving.
Hey, you
We
can get
have
up.
yeah, it is very good. And if they suffer from temperature or the winter is coming, which is already here, they're heated. So they don't have to worry about just sitting in a cold leather chair. Um, we don't have computers as regular doctors. If you see here on this side of the room, we don't have a computer. So our doctors, they have an iPad and they have also other systems where when they're talking to you, they can just type everything there, but it's easier and they take longer times with the patients. And in this side which we can see it, but in the other wall on this side of the room, we have a big TV. On that TV, the provider can show their test results, the x-rays, information. So if they have flu, they can show information about flu, how to manage the symptoms, and how to spread it, and how to make sure that you're cleaning everything. So our doctors have big TVs so people can read, because if somebody has like in my case, I'm wearing glasses, and they have vision, problems with vision, they can actually see in a big TV what they're talking about. Um, and Also we have noise cancellation system. So when the door is closed, that noise cancellation system, we like turn it up, and nobody actually can hear the conversation that is happening on that exam room. I always put the example. When I go to my mom to her doctor, I can hear everything what is happening behind the wall.
Right.
Everything. Yeah. In our case, that won't happen. Like even if you stand on the outside of the door, you can't hear anything that's happening inside. Um, And we have the two chairs too, which if you want to bring a caregiver, if you want to bring a family member, you can bring them because, four ears are better than two. And I always give the example of my mom. My mom didn't realize that she had cancer until one day that it didn't go to her appointment. She didn't process that. She didn't know that she was going through that until the doctor actually said and said, "Hey, Karen, you have it." I knew it, but I didn't realize that she didn't realize that what she was going through. So we always tell the patients, hey, if you want to come with one or two people, they're all welcome. If you come with more people, we try to have a space so we can bring another chair, but we have a space for other people to join. the appointment so they can listen to what the patient is going through. That's very important. Um, and on the right side, we have our community room. So this community room is for social and educational activities. That's where we do all our activities. Not all the community rooms or activities rooms are the same. They're different. They have different layouts and different sizes. But that's where we do everything. The lunch and learns, the doctor talk, the bingo, the price is right, the painting sessions. Um, we also tell our patients, hey, if you have a Bible study group, if you have any kind of group that you join and you guys need a space, just let us know because you can also use this space for you. You just let us know in advance and we can give you snacks and beverage and they can learn about Centerwell and they can also have a space that you guys can just be here for, I don't know, how long you need it, but you can join the activity center or the activity room without any cost. So we always says that this is also a community center where when people can come here and ask us questions if they have it or if they need a space just to just to be in the activity room, go ahead because we welcome everybody here. And then we have this PowerPoint is not updated because we have the 5 locations. Um, but we have
Where's your fifth one?
the fifth one is on West 86th Street on the College Park location.
Okay.
Is West 86th Street is next to the Trader Joe's there. That's the most recent one. We did the grand opening in August. Yeah, I think it was August. So we have Pendleton Pike, which I'm located right now here. We have Irvington, which is on East Washington Street. We have, I don't know why, yeah, sorry, East Washington Street. We have Eagle Dell, that is on Lafayette Road in the west, on West Washington Street, and the College Park. We have been open since October. It has been a year since we opened here. Well, we are just fairly new to this market, but not new at doing this. So people don't have to worry about it's like, well, they're new. I don't think they know what they're doing. We actually has been doing this for a while, so people, they can trust us in their health. And this is just like a little overview of all the things that we do. And I like to see this because sometimes I forget to say things and I just read one, which is very convenient. And I think I didn't say it. The on-site lab. So our patients can get the lab work done here. They can get vaccine and lab work done here. So they don't have to go somewhere else to get the lab work done. There's sometimes where it's like, well, I have to go to sample quest diagnostic, I have to make an appointment, and this always take forever. Here, they just get it done right here the same day and they don't have to worry about it. And let's see, I don't think I forgot anything else, but there's always a lot of information what to provide. Oh yeah, actually, look, the live video visits, so televisits. Sometimes the providers do televisits, so patients don't have to get out of their home, or if they're sick, or it's just like a minimum like follow-up appointment with the provider or with the patient. They just do those televisits. Like I know somebody very well that the last appointment she did a televisit because it was just a 15 minutes. Hey, how the medication is going? It's all good. Okay, let's just keep the appointment that we have for next month because if everything's going well, you're all good. You don't have to worry about it. So we have a lot to provide. Um, there's always more information. But yeah, it's Centerwell is different than other
Do
providers.
you guys
And
have a particular like referral hospital when it goes to that, or is it open to any of them? Because I know that a lot of doctors are captive to a particular hospital. So
I always say that it depends of the patient. Some patients like they really care about where they go to, and they can pick between IU, Riverview, St. Vincent's Community. I know as an example, Dr. A, which I can show a picture of her. Dr. A, she likes to send people to community network to get, I don't know, x-rays or things like that, because she comes from community. So she knows people there and she knows things, that she can think of. But we can refer them to any network, because some people they just actually like and said, no, I don't want to go to community, I want to go to IU. So we have a whole team that will take care of the referral. So the team will call the patient and said, hey, what are the days that you're available and from what time to what time? So that team will call IU or St. Vincent's or community and make the appointment for the patient.
that's
For
great
the
because if somebody comes in and they've already got all their records at St. Vincent's or IU or at community or what have you, I can see that that'd be real beneficial that they don't necessarily have to start over.
Yeah, so that's one of the things too, that for the first appointment, we don't ask for records. It's actually after the first appointment when the patient says, you know what, I like this appointment, I'm gonna make the transition. So at the second appointment is that when we will have already the records, because the patient will sign a form to release the charts and the information. So at the second appointment, we will have all that, because the front desk and behind the scenes, they will request all that information before the second appointment. So they don't have to worry about being calling, hey, you need to release my charts or my information to Centerwell. No, we will do that for them. And
Okay.
some networks are more complicated than others, but we have people that takes like they're in charge of doing that.
Well, that's
Um,
excellent. Well, this is, I brought up Oak Street just because that was the first time I saw this model, and then I was real tickled when you guys came to town, and I've been to a couple of your communities like grand openings and stuff like that. So your offices, so I love the fact that this model is now here. So that people have that option and have the care to stay healthy rather than trying to just patch things up.
yeah, I have to be very honest. I didn't believe in the healthcare system before I started working for Sanawell.
Okay.
My my mom was born in Michigan, but she grew up in Venezuela, and I grew up there. And I came to the States. We moved back to the States 9 years ago. And coming from another country, I never believed in the healthcare system here because I never had a relationship with any doctors like I did there. My grandmother was a nurse for 40 years. Um, I have family working in the medical fields, and when we moved to the States, I was like, this is not the same care that we had there. I mean, this country should have a better healthcare than where we come from, and I don't think it is. So when I started working here, I was like, well, this is gonna be another clinic, and I don't think it's gonna be meaningful, and I don't think it's gonna be like that great as they say it. And then after months working here, and me personally, I have a family member that comes here and that sees Dr. A and that she loves Dr. A. And as I get patients, like on Saturday, I have a daughter of one of my patients giving me a hug and saying, Luis, Dr. A has done in 3 months what other doctors didn't do in 2 years. Those are the things that it changed my whole perspective and it made me believe in the healthcare system that we provide and like the care that we give the doctors, the front desk, the center administrators, the medical assistant. that all of them actually care about the patients that they come through the door. And I'm telling you, I'm very happy and I love what I do because this is something that I can help people. And I would say if you don't even that you are not a patient of Centerwell, if you need to find a resource for something, you can contact me too because I am somebody that will connect you with somebody. Some people are not Medicare eligible and they are on Medicaid, but I meet them and they're like, hey, Luis, I have food insecurity. Sometimes I don't have food. Okay, let me connect you with a food pantry. Let me connect you with Meals on Wheels. Let me connect you with these people. So some people don't even have to be a patient for me to help them. So that's the other part that I love about this show. It's like you don't have to be a patient, but if I can find the tools and resources for you, I will do it without hesitation.
Well, very good. Well, you definitely show them Life's Copilot because there's a lot of good stuff on it. So
Yeah.
anyway, well, thank you so much for sharing with us today. I really think that this is going to be great. Do you mind? I see you put your contact information there. I assume if people have questions, you can probably be a kind of a source and a go-to.
Yeah. I mean, like I always tell everybody, if you have any questions about anything about healthcare, um, if you want to have a tour, because we do tours here at the clinic. So some people are like, well, let me show me the clinic first before I even sign up. I said, okay, I give you a tour of everything and show you what we do and how we do things and how the actual clinic looks. Because, you know, some things see them in pictures and somebody telling you, but if you see it with your own eyes, you can see what we can offer actually. But if they have questions about anything, I can find resources for them. I'm somebody that has always been one of my goals in life, and since I was a kid, is was helping people in some way or another. I wanted to be a psychologist. Then I was in bank helping people with their first house, their first account, their first credit card. Now helping people here improve their health, and I can help people with other stuff without that they have nothing to do with Centerwell. I love to do that. So I will try to find answers and any resource that I can to help people out there.
Well, that's excellent. Well, Luis, thank you for your time, and this was great. So I will get you a copy of this video as well, so that you can do with it as you please. And it will be on our website, and it will be on. It'll go out in a newsletter and stuff like that. Let me do something real quick here. Let me do a quick
Yeah.
share. Find what I was looking for here. So we just did this one today on the October 22nd. We have Cheryl Curry, who is going to be coming on talking about Adult Day and what that is. And a lot of people are not aware of those resources for like respite care or just so that you can work and still have somebody age at home. Then we have one coming up on how to get rid of mom and dad's house. That's on November 14th. Kind of hitting the easy button so you don't have to go through all the processes. We have one on, for Hospice and Palliative Care Month. We have Jennifer Budenbaum coming in to do that one. December 12th, we have Lisa Cole with Home Repairs for Good. That is a really cool program where they will come out and fix your house for seniors and things like that. So we have those coming up, and I also know that I have coming up. This is on my Scopilot website. I also have just booked something for January. I don't have it on there yet, but
Yeah.
something that really can be beneficial to people. This is a guy who will come in and have that talk with mom or dad about taking the car keys away.
Oh wow.
Yeah,
That's
so
fire.
that's not going to be a fun conversation. It's not going to be an easy conversation. It's there. I didn't know that there was actually somebody that, as a profession, has that conversation for families.
I didn't
That
know
could be
either, and I need
beneficial.
his info.
Huh?
I didn't know either, so I need that person's info to have
Yeah,
it in
here
my
you go.
report.
So, because that could possibly be a big plus for families. So, thank you so much, Luis. We will see you soon.
Thank you, Jim. Thank
All
you,
righty.
people. Have a good
Bye
day.
bye.